Right. Okay.
Across the UK, elite helicopter teams are saving lives every day. Bringing the hospital to the roadside in a race against time.
Now we're going to straighten his leg out. If you grab his leg.
These are their stories.
15 minutes, man. Understood, thank you.
Can you just stay still and we're going to get you out?
That's it. Big release. Come and give him a kiss if you want.
She's been an absolute star and very, very brave.
All right, sweetheart.
Durham Tees Valley Airport, operations centre of the Great North Air Ambulance Service. The charity gets thousands of calls each year. Today, paramedic Jane Peacock is manning the air desk.
Hello, Air Ambulance. Right, and do they not say whether he's got neuro deficit or how has he sustained them?
A trained paramedic answers the red phone to try and sift out the more serious jobs from the less serious.
I'll ring this number, get some more info and I'll let you know what we're doing. All right, bye.
If we were busy on jobs that were less serious and a really serious job came in, we wouldn't be available to go and help save them.
Hello, Air Ambulance.
A report has come in of a life-threatening accident only 4 miles from base.
Oh, dear me. OK, I'll pass you on to Andy while I get ready.
Yeah.
Andy, Dion.
Have you got an address actually? Because it might be first on scene. Diligence.
Thank you. My pleasure. Is that the address?
Dilgrove or
Diligence.
Diligence?
Yeah.
Very nice.
Oh my God. Sounds like it might be a child.
Oh no. Looks like right.
Last time left.
The helicopter is the fastest way to the accident, but it will still take 7 minutes.
Jane, what is it?
All we've got, Dion, is what I've given you.
No, someone under a car, that's it.
Yeah, I think it's a child.
The more information we get about an incident before we arrive, the more prepared we are for it. We've got a better idea of what we're going to need to do when we arrive on scene.
Oh, it's just down here somewhere.
We try to have a quick chat about the job to decide who's going to do what on scene, but obviously not knowing exactly what's going on before you arrive adds a bit of uncertainty.
That's down here on this junction. The white van stopped with first on scene. Nobody there, just people running around, Jay.
Are you looking?
10 o'clock.
Right, well we can't fit anywhere down there.
We'd have to go this field here.
Right, I'll just come round this way and then turn round back into Wynn. Yeah, that field's a good option actually, straight down the road.
We'd have to take everything, Dion, but nobody there.
I was going to say, it's not far, so all
No.
the defib and stuff.
Yeah, suction, everything. Still under the car.
Not only is it really fast using a helicopter, it also gives you a bird's eye view of the scene, which is really helpful because we were a little unclear on what actually we were going to on this job.
Right, clear out everybody.
The incident turned out to be a number of streets away in the middle of a housing estate. Lucky for us, bystanders seen where we were landing came to escort us to where we were actually going.
Is he still under the car? Yes, he is. First on scene.
That's just thanks, Jane.
In the few minutes it took to get to the incident, the ambulance service and the fire crews had arrived. Initially when we got there we couldn't quite work out what happened. It was all a little bit confusing.
It looked like a car had basically mounted the pavement, gone through a lamppost and then hit a pedestrian, ending up against another parked car, and the pedestrian had been crushed between the two vehicles.
Let's go ahead. Yeah, Jane, I think that was RSI. Over.
RSI, or rapid sequence induction, is using drugs to get a tube down a patient's windpipe.
It was safer to give him an anaesthetic and pop him off to sleep so that we could take over his breathing and keep him safe for the transfer into hospital.
Just relax. Relax, okay? Look.
Mum, come here, I'm Jane, one of the paramedics in the air ambulance, alright? He's been knocked over. Okay, alright? What happened? We don't know yet what's happened. The police are trying to find out what's going on.
In Teesside, 19-year-old Carl has been crushed between two cars, sustaining substantial injuries.
At the time we didn't know exactly what had happened. It looked like the patient had just been walking down the road and all of a sudden a car had mounted the pavement, gone through a lamppost and then hit a pedestrian, ending up against another parked car with quite nasty head and face injuries.
You alright, Carl? Carl, you okay? Fantastic, mate.
Carl's mum and sister only found out about the accident minutes ago.
It's sad to think that if he left home either 30 seconds earlier or 30 seconds later, then the car probably would have missed him.
And you've got some fentanyl if required.
Alright, Carl, just relax.
Instead, I'm left with a young lad in front of me who's fighting for his life.
Carl, off to sleep, sweetheart. Yep, thank you.
Carl is put into an induced coma for the journey to hospital.
And you want that?
Got one. Which way to the aircraft? Ambulance and then the end of the street.
There.
Going straight down there? Straight down, right.
It's been 33 minutes since the crew arrived on scene.
4.5, 4.4, come on, there's a good thing.
I know from evidence that if patients don't get to the hospital within the first hour when they've sustained serious injury, their chances of survival diminishes enormously.
Yeah, that's it, where the bollards are.
So that's why using a helicopter can make the difference between life and death.
Move out the way, please.
It's just 4 minutes to James Cook Hospital by air, compared to 20 minutes by road.
That side, guys. Off we go. Keep him high, please.
Thank you very much. Got our own too, got that.
Let's go ahead.
Candy, can you realise James Cook, please?
19, 9-year-old male, pedestrian.
He's been reversed over, trapped between two cars.
Right, get going.
Hello there, it's just Andy from the air ambulance. Got a trauma pre-alert for you.
Right, starting.
He's got a significant head injury and max fax injuries.
Doors good in the back, but we're loose.
He has been RSI'd at scene due to cerebral agitation. Thank you very much. Cheers, Raj. Silence back.
screen's down and locked and the brakes are on. You two are both loose and about everything else is good to land. Are you happy, guys?
Yeah. Jane, just read us some numbers.
Pulse 91, SAS 100. BP 9266, 1128, 78. Bring RSI.
Yeah.
Coming down.
Okay, let's get a move on. Into 3D on this one, look. Hello.
19-year-old male, unfortunate pedestrian, he's been crushed between two vehicles. No problems with the tube, he's got good bilateral air entry on his chest, belly soft, his pelvis is splintered, his legs are okay. He's got a big laceration under that right arm in his axilla. That's all there is to tell.
Please. Got a bit of blood in his head, but I don't know exactly where it's coming from. Not sure if he might have a burst of skull or something because he's got a couple of blood cards as well. We've put an epi stat. I want to be honest and open with them because that's what I would want myself. No doctor can say 100% this person's going to be fine and they're going to live happy ever after because nobody actually knows.
Happy with that, mate?
Yeah.
With everything.
We get called to lots of incidents where people have made a poor decision and that's what's resulted in the accident. However, in Carl's case, it looks like, he was literally just in the wrong place at the wrong time. It's awful and he's been very unlucky, but we can't let it get to us, otherwise we couldn't continue to do this job.
Carl will be kept safely in the induced coma until he's been scanned and the full extent of his injuries has been assessed by the hospital team.
This is the other lovely side of the job. It's cleaning. There's a distinct difference here. Paramedics clean things properly. Doctors just wing over it. They, look. What's that?
I said it needed a wash.
You said it needs a catch wash. I don't call that a catch myself. Minger.
Jay, we would have been so much quicker, but she's been OCD cleaning. So you've been cleaning the scoop?
I've been cleaning it properly.
Where is it?
Bloody doctor's out the job.
Where is it?
You've got it?
No, the land crew half-inched it back.
You're kidding me. Oh, you're having a laugh.
Time to go.
Oh, here, no. I can't have that.
Jane, we can't have gone.
This one?
I'll be really impressed if she comes back up here with that scoop.
There we go. Happy days.
That was fear. The crews were like, oh my God, the wrath of Jane will give her the scoop. Just ram it in there, girl.
Okay, my love. I'm on it.
ETA on 3 minutes.
170 miles southeast at Norwich International Airport. The crew of the East Anglian Air Ambulance Service are making the most of their downtime.
So as you walk to the car, what you see is you've got a male lying on the road, as you see. There's a dent to the bonnet of the car and there's a bullseye to the windscreen.
Not only is Dr. Victor Inyang on call today, but he's also training medical students.
When I interviewed for the Air Ambulance back in 1995 as a registrar, it's quite a competitive process. And so what the students are doing now is giving themselves an edge. So that when they come to compete for air ambulance jobs, they've shown an aptitude and a desire to chase the subspecialty. He stepped out on the road, unfortunately, and as I described, hit by the car. Whoops, sorry. We'll pick up on that when I come back. All right. One of the first things the students will learn from us is that this is an unpredictable job and you never quite know when you're going to get called out. Hi, Norwich.
This is an emergency line for the air ambulance, mate, so can you hang up? Yes. Do you want a Barney double glazing? No one ever rings that line unless it's our control, so every time that rings we expect a job. But it's a bloke trying to sell us some double glazing.
All the call springs, just...
Norwich.
This time it really is a matter of life or death. Paramedics in the village of Snettisham have requested an air ambulance for an urgent transfer to hospital. A 66-year-old man has collapsed with serious chest pains.
Ambulance emergencies, tell me exactly what's happened.
I live alone and I think I might be having a heart attack, I'm not sure.
So to describe what's happening?
Sweating profusely and I can't get my breath easily.
Right, okay, so we've got help organised for you. I'm going to stay on the line with you.
Right.
Okay, if anything changes, just let me know.
E1, the ambulance crew are going to meet you at Snettisham Primary School. Grid reference of Tango Foxtrot 687342.
I know exactly where that is. It's right next to the church.
To make extraction quicker, the land ambulance is bringing the patient from his home to a cricket pitch in the village.
I think they're still there. I can see the ambulance outside the house still.
Yeah, I can run there. We're overhead and now heading to the cricket pitch, over.
In the setting of a patient having a cardiac arrest, you want to get the patient into hospital quickly. For those patients who don't live near a major cardiac unit, that's where the air ambulance comes into its own to get them there quickly.
Okay, one on the ground.
Are you right, Miguel? Yes, mate, yeah.
Ground at both 7.
Angle 1, just let you know the crew has just left scene. They should move you any minute now.
Yeah, it's all received, they're now arriving. Gentleman's name?
So this gentleman's Philip.
Hello, Philip. Yeah.
Started complaining of central chest pain, felt clammy, nauseous, shortness of breath about 8:30 this morning.
Okay.
Vomited once, went upstairs, collapsed, which is when he called us.
Philip? Hang on, mate. Okay, we're going to arrest, mate.
His blood pressure is so low.
His condition is deteriorating.
He's got a cardiac arrest.
Okay, so we get someone straight on the chest.
Okay, let's just start chest compressions. Okay.
The crew of Helimed 85 have been called to transport a patient with serious chest pains to hospital.
Okay, everybody stand clear, shocking now.
Just minutes after arriving on scene, Philip's heart stops beating.
That's it. Do you want to do the airway, please? Okay, 2 minutes.
Okay, stop what we're doing. Do we have a pulse?
Yeah, there is a
We have a
pulse.
pulse. Okay, so I'm still going to ventilate him. So Victor, I think we should go for a tube on this patient.
Okay. With the patient in cardiac arrest, it is essential we take over the patient's breathing to ensure sufficient oxygen is getting to the brain to reduce the risk of brain damage. Just a minute, just a minute. We probably need a better bougie. That one's a bit, it's quite rigid.
Really long.
From the time you give the drug to you pass the tube, you hold your breath. And if you need to breathe, the patient needs to breathe. And that's how long you have.
You happy to have another go, Vicky? Yeah?
Yeah, okay. Can I have the blade, please? Let's have a look.
The tube is not going down Philip's windpipe. He isn't breathing, and time is running out.
Let's go with Nigel. Okay, ready?
Right, yeah. I think that's in.
Okay, let's secure that and let's go.
We've got a donut bandage.
The Norfolk and Norwich cardiac unit is over an hour away by road, but only 20 minutes by air.
It's weighing up benefits versus risks. If Philip had a second cardiac arrest in flight, it becomes more difficult to deal with that in the aircraft. I still think we should fly him.
Do you? Right, okay.
Because time is of the essence for this chap. On this occasion, we felt, with Philip, the benefits of flying him to the right hospital quickly far outweighed the risk of him having a further cardiac arrest in flight.
Ready, set, lift. Right.
You can only hope that you made the right decision.
Okay, once we get on the ventilator. Hang on, mate.
Okay, thanks for your help, guys.
Go.
Even after 25 years, I still get challenged every day. I still stop and think, wow, that was an interesting case.
Okay, that's my first intubation I haven't got in 10 years.
Is it?
Yeah.
Glad it was you, not me.
We love challenges, come on. We like patients to push us.
Dropping down to 31 again now.
Philip's heart rate is dropping to a dangerously low level. Without intervention, he will certainly arrest again.
Just start pacing things. And we just increase output to 70.
The air ambulance carries a piece of equipment that can act as a pacemaker.
That is the final option to stop another cardiac arrest.
Covering 50 miles in just 18 minutes, Helimed 85 touches down at the Norfolk and Norwich Hospital.
Okay, and all the way now. Okay, there we go.
It's quite tall.
When you're ready, I'll do a very brief handover because he's not very well. This is a 66-year-old gentleman, chest pain at about 8:30 this morning, inferior MI, cardiac arrest at about 0940, VF arrest, one shock came out of it. He went very bradycardic en route and in spite of 3 milligrams of atropine was dropping to about 20 per minute. So he's being paced at the moment.
Thank you.
Okay.
Very much.
Thank you. The decision to fly Philip definitely paid off. But he's not out of danger. He still has the risk of going into cardiac arrest. So there's no way of being certain that he will get through.
Philip will undergo an angiogram to determine the location of the blockage in his arteries before receiving treatment.
Norwich Tower, good morning. Helimed 85, just literally from the end. Would we like to jump for this on the boundary?
Helimed 85, roger, VFR, not above 1,000 feet, please. Traffic in the circuit left hand, 1,600 feet.
Another life saved, eh, Victor?
Wow.
I like these jobs because they always make the doctors nervous for the families.
Once there to be nervous about.
If there's a tube you don't want to miss, Victor, it's
No.
A nice day for flying.
Penrith in Cumbria. It's business as usual for the crew of the Great North Air Ambulance Service. Today, Laura Atwood is the doctor on duty.
I'm a Lieutenant Colonel in the Army Reserve. I've been in there for 13 years. I think the military can point you towards having a nice regular routine, and it does give you that control in your life to make you work by.
He's doing a good job. I think marks out of 10, I give him a good 10 out of 10.
In between incidents, we don't mind keeping busy on base. There's always things to do. But as doctors and paramedics, when that red phone rings, we're ready for action.
Windermere. Yeah, what's the details? Okay, give me a card, please. All right, thank you very much. They're on their way.
It's a 14-minute flight to Windermere, where a tree surgeon has had a substantial fall.
This one down here, Laura.
Oh, on the left?
Yeah, down there.
You see anyone?
There's tree surgeons down there. Okay, so probably looking at the field down.
There's a field opposite.
There is quite a decent slope in it, so I might have to go a bit lower down. Can't see any wires anywhere, can you?
No, I can't take this side.
Some horses on the field down on the right over there.
There's a few more cows in the tree.
They're bulls.
Past the tree now. Other bulls ran away.
One side. I'll just let it come past. Keep a good eye on these, man. My concern is that they come running towards us as we land.
How did they get out?
Yeah.
Hiya, how you doing? My name's Laura. This is Stu, who's behind me. Okay, talk to me. What were you doing? How high up were you and what happened?
I dropped down from the red rope into the other limb and I had a secondary line on. I was just attaching another secondary line and was just waiting that and whether something snapped or...
Okay. How did you land as you are now?
Almost exactly in the recovery position, yeah.
It looked like he'd fallen roughly 10 metres from the tree onto the tarmac. If he had landed onto his head or chest, it could have been quite a different story, maybe even fatal. Also, if he'd fallen a few more inches to the right, he could have landed on his chainsaw, so that could have caused quite significant injuries to his lower limbs.
Just talk to me, where's the main pain for you?
In my back.
The lower back. What about around the hips or down that right leg particularly?
Well, there's a general stiffness developing and a tingling sensation in my right toes.
Having that tingling in his toes pinpoints towards potentially a fracture to the lower spine, which is what I was concerned about.
We'll just take it nice and slow and just get you feeling more comfortable first of all. So I'm going to put this collar on.
If we were to move him in an awkward manner, it could potentially increase the damage to his fracture, which could lead to permanent damage to the spinal cord.
Okay, on roll, ready, steady, roll. Fantastic, okay, now I've got the back of your neck, I'm going to pop that underneath just so it's comfy for you, okay. Any pain in that side of your hip at all?
Just slightly muscular, I would say.
Anything coming down this leg?
No, it's more underneath.
More in that lower back.
The two concerns was either the lower lumbar spine fracture or a pelvic fracture, and the problem is the two can present fairly similar, so we just assume the worst automatically and therefore put the pelvic binder on and keep his spine immobilised.
You straighten your legs out for us, would that be okay?
Yeah.
And is that sore in the back?
It's underneath.
Underneath there, okay. I'm just going to pop a little drip in your hand so we can give you some painkillers, okay? I mean, so really we're probably just lower back pelvis, Stu. What's the nearest place from here is...
Preston would be ideal for me.
What the patient wants.
Luckily for him, the closest major trauma centre is Preston. And we can get him there in minutes, where a road journey would take up to an hour.
Right, just a little bit of morphine going in. And then what we'll do after this is put you on this yellow scoop, just so we can lift you and then get you onto the back of the helicopter, okay? Right, shall we lift up?
Yeah. Sometimes you can have patients who are chatting and talking to you, but you need to keep a close eye on them because things can change quite quickly with them. So certainly when people are quite badly injured, especially in the younger population, they can really sort of hold their own for a period of time and manage their pain quite well. But actually, for the space of 1 or 2 minutes, it can sort of dramatically take a downward spiral. We do have to watch out for that.
Just lift it up a second, that's lovely, thanks. So SAT's 97, heart rate 64.
Here it is.
Yeah, 35-year-old male fallen out of a tree, landed on tarmac. His heart rate 86, BP 90.
Has had morphine for pain relief if it's packaged. And we'd be at Preston in about 18 minutes.
Yeah, that's received, mate. We'll give Preston a ring for you.
Yeah, Roger, cheers, mate.
Hello, mate. It's just Great North Ambulance here. Just give you a pre-alert for the patient we're bringing in. Cheers. Bye-bye.
On 3, 1, 2, 3.
From A&E, Matt will go into the CT scanner. All his injuries will be looked at and imaged to check for any sort of fractures, any internal bleeding, any organ damage. So he's not out of the woods yet. He's still got to have some assessments and imaging done first.
At Durham Tees Valley Airport, the Great North Air Ambulance team are halfway through their 10-hour shift.
Yeah, that's Mark speaking. One male with serious leg injury, one male with serious chest injury.
An urgent request to scramble has come in.
Smash him. 6-3 are on the way, mate. Cheers, thanks. Bye, mate.
Yeah, first popped up as Kielder. We've been called up to near Kielder Forest, and it sounds like two motorbikes have collided with each other. Obviously both rides have come off. Usually when it's two motorbikes that hit each other, it's quite nasty. It's going to take us about 20 minutes to get there.
Picked the road up before the grid reference given and was backing up, I think.
Yeah. It's somewhere down here, on the left. Yeah, I've got nothing so far. Right, I've got no stationary traffic up that way.
There it is. Out there, Jay.
And you'll be clear 3 o'clock direct.
Hey. Clear out.
When we arrived on scene, there was no other medical personnel there. There was just the police. We were directed to Johnny, who'd been thrown about 20 foot down an embankment in the bushes. The land ambulance was just a few minutes away, so they dealt with Stuart, the other biker, who wasn't as serious.
Hiyo, Johnny. Right.
You see that he's got pain all down his left-hand side.
Okay.
Pain in his neck. He's trying to just feel pause. He was trying to get pins and needles in his fingers.
Okay.
Pins and needles can be a worrying sign suggesting that he may have injured either his neck or his back and done some damage to his spinal column.
He was complaining of being cold.
Just slowly breathe in now for us. Just nice and slow. Good man.
While Jane and Dion assess Johnny, the land ambulance team treat his friend Stuart, the other biker, who has less serious injuries.
What we found at the moment, love.
Yeah.
All right, you broke this leg. We're going to put a little plastic tube into one of your veins. We're going to give you some strong painkillers, all right? Probably not remember most of this, all right?
Johnny, you're going to feel a little scratch in your arm here, okay? Good man. Thanks, thank you.
2 minutes.
Just keep hold of his head. Don't, no, just keep hold of it, yeah. 2 minutes.
Are you his mum? Okay. This is mum.
Oh, right, this is Mum.
I've got no idea what happened. I was in front. I just knew they weren't behind us, so I turned around and came back and saw them all over the road.
Mum, can I get you to just hold his head a second?
Yeah.
Right, what's going to happen now? We're going to straighten his leg out.
Right.
He's going to shout and scream, but he's not going to remember anything about it. Okay?
Breathe. Breathe.
Perfect.
That's
There you go, that's it, hold him there.
Mum's here, Mum's here.
Jane, just while he's in that position, do you want to see if you can get this under him?
Okay.
Oh.
Yeah.
You are.
I love you too, darling. I really love you.
Ready, steady, roll. That's it. Okay. Ready, steady, roll.
That's it. Johnny, it's all done, my love.
Motorcyclists do often sustain multiple serious life-threatening injuries because they've got nothing else to protect them.
Our cannula pack and that green drugs pack, Jay, packed away.
We suspect that Johnny's broken his leg, but we also worry that he might have done damage internally and he could be bleeding.
Can you hold this leg, please?
Johnny's legs weren't in a normal position. They were bent, but he could also have damaged his pelvis. So we had to straighten out his legs and put a bind around his pelvis to try and prevent any further internal bleeding.
That's it. I'm in place. That's lovely. All right, Johnny, your mum's going to follow behind in a road out. Okay? Stupid. All right, in we go. So we have to lift as high as we can for as long as we can. Okay, ready? Go.
You're in the helicopter. We're going to take you up to the hospital, okay?
Where's your mum?
Your mum's coming up in a car. She's following up in a car.
While HeliMed 63 takes Johnny on his 13-minute flight to the RVI in Newcastle, his friend Stuart is loaded into the police helicopter and will follow shortly.
My job encompasses a whole package because it's about treating a patient as a person. They are real, they have feelings, they have real pain, and it's about supporting them.
Hey, Johnny.
The air ambulance has to clear the helipad to make room for the police helicopter that is carrying Stuart, the other injured biker.
Yeah, so there you go. He's got what looks like pain in both shoulders, but nothing clinical deformity-wise. A lot of pain in his C-spine. Chest and belly are okay. His pelvis, his legs were splayed at scene, so his pelvis is a query. And he's almost certainly got a closed shaft femur. His neurology's intact, his numbers have been absolutely fine, it's totally stable, so yeah.
Both Johnny and Stuart will undergo tests and scans to determine the full extent of their injuries.
Helipad's clear now.
Yeah, we're good. Yep.
Okay, we got all the kit back that you took? I'm just tidying up 1 second. I've got your radio up here, Dee. Yeah. Right, we've got both bags. Got scoop, board, Hendrick, off him, or we're just using
No, we're getting that later.
Yeah, that was it really, wasn't it?
Yeah.
Yeah, that was it. Okie dokie, here we go.
General stiffness developing and a tingling sensation in my right toes.
Right, we do have 3 greens and the brakes are off.
Don't they do?
Going to cardiac arrest.
Okay, so we get someone straight on the chest.
Okay, let's just start chest compressions.
Without that helicopter, I wouldn't have been here. You realise just how fragile life can be, if you like. because 1 minute you're fine and then the next minute everything goes wrong. I have a rescue dog, Buster, who is quite a pal. You appreciate things like that probably more so than I did prior to my heart attack.
It's a very rewarding feeling that you have, in your own little way, contributed to a positive outcome, and that's what keeps us coming back for more.
I think life is never going to be normal, knowing what I've been through, but I think it's only going to improve me for the future.
He did look quite bad. Someone who rang the ambulance also said that he's possibly dead.
It's going to be better if I just joke about it, just keep it light-hearted, be light-hearted about the situation, and just be grateful for those who helped me.
Generally speaking, with the patients we deal with, we follow their care for the next few weeks because it's quite nice to know where they ended up and how they did.
Right, what's going to happen now? We're going to stick his leg out. He's going to shout and scream, but he's not going to remember anything about us.
Oh!
There you go, that's it, hold it there.
To completely heal, I think it's about 6 months. I would say it could have been a lot worse.
That day's put down as the luckiest day I've ever had.
I was a bit put off for the first couple of days when I was lying in hospital and thinking about it, but as of now, I'm really looking forward to getting back on the bike.
Bring it on.
I think doing this job makes you see that anything can happen to anyone at any time. If you're worried about it all the time, you wouldn't ever do anything, so you may as well just not think about it and get on with life.